Developmental disturbances. We know during embryologic development, during intrauterine development, any malformation or any anomaly leads to deformation in the skeleton or bone. Craniofacial anomalies, basically they denote deformities in the skull or head. Okay, so basically what is the anomaly? Anomaly is basically irregularity or something which is different from normal. Okay, so the craniofacial anomalies, they arise because of lot of factors. For the first and the foremost important factor may be the combination of genes. We know the individual, he receives his set of genes from both the parents. Okay, one male parent contributes one gene and the female parent contributes one gene. So during combination of the genes, during pairing up, if any problem arises, if there is any mutation, if there is any abnormality in the mutation, if there is abnormality in the chromosomal structure, it ultimately leads to a craniofacial anomaly. Okay, and deficiency of vitamins, especially the folic acid deficiency, it has been associated with lot of developmental disturbances in the infant. Okay, lot of syndromes like the Treacher-Collins syndrome and other syndrome are associated with this deficiency of folic acid. Folic acid, basically it is found, it is like a B complex vitamin. It is found in oranges, in citrus rich foods, in green leafy vegetables. So either the deficient intake of folic acid during pregnancy is associated with the craniofacial anomalies. And the interaction of the genes with the environment, sometimes what happens, the genetic constitution is just altered by any environmental factor like exposure to alcohol, exposure of mother to alcohol, or any infections of the mother. They also lead to anomalies in the individual. Okay, anomalies in the infants. So what are the common craniofacial anomalies, or what are the common developmental disturbances seen in the skull or head and neck region mostly? They may be the commonest ones are the occurrences of the cleft lip and palate. We know cleft is nothing but a break. Okay, it is due to non-fusion of the sulcuses. The embryonic lateral sulci of lip are present. If they do not fuse during the intrauterine development, it leads to a cleft lip. Okay, cleft lip, it may be also unilateral or bilateral. It just begins in the upper part of the lip and extends through the lateral philtrum up to the nose, and sometimes the cleft lip, it extends to involve the soft palate and the hard palate also. Okay, and cleft palate, it is due to the non-fusion of the palatal processes. We know maxillary process, medial nasal process, lateral nasal process fuse at about 8th week of embryonic development, and at about 10th week of embryonic development, both the palatine shelves fuse. Craniosynostosis, basically it is a developmental anomaly which is characterized by early fusion of sutures. So premature closure of suture, it disturbs the normal functioning of skull, normal functioning of brain. So premature closure of suture, it builds up a pressure in the head. Okay, so brain development is hampered. Even the development of skull and facial bones is hampered because of the early closure of sutures. So craniosynostosis. Hemifacial microsomia is another developmental anomaly which is characterized by reduction in the facial bones along with characteristic orofacial malformation. Okay, vascular malformations, as we know, they are just present at the time of birth. These malformations, they denote any disturbance occurring in the blood vessels. There is characteristic during embryonic development. There is characteristic development of this artery and veins. So if there is excessive growth of the arteries and venous plexus, that leads to this vascular malformations which are present at birth. Similarly, hemangioma denotes malformation which is present at birth. Mostly it may appear at about 1 month after birth. They also denote the proliferations of the blood vessels which are characterized by their characteristic appearances of telangiectasias or the birthmarks like thing. So these are the common craniofacial anomalies we see concerning the oral and maxillofacial region. Okay, so any malformations for that reason, how they arise, what is the mode of inheritance of the malformations, and what is the science behind the inheritance of this malformations. Okay, basically the genetics plays an important role in transmission of diseases from one individual to his generation. So, what is the gene? The genotype is nothing but the genetic constitution or genetic makeup of the individual. Whereas phenotype, it denotes the interaction of the genes with the specific environment. That denotes the phenotype. The phenotype is nothing but the characteristic of the individual, all the visible characteristic of the individual by which he is identified. That is the phenotype. So we know all the chromosomes in our body, they exist in pairs. Similarly, each chromosome is also made of genes. Genes exist in pairs. So the different levels at which genes occur, those are the loci of gene, that is nothing but the alleles. So when the individual has two copies of the normal gene, that is the same gene is present, then the individual is known as a homozygous. If only one copy of allele is present in the gene, then the individual is known as a hemizygous individual. So all the chromosomes exist in pairs, even the genes exist in pairs. Only the gametes, that is the ovum and the sperm, they are carrying a single gene. Okay, the ovum and gamete, they are carrying a single gene. They do not exist in pairs. When the fertilization of ovum and gamete occurs, ultimately the new individual produce, he or she has a combination of genes. Again, the genes exist in pairs. So this is how the transmission of gene occurs from the parents to the individuals. So now the newborn individual is having a gene, one each from each parent. Okay, one from the male parent, one from the female parent. Suppose the male, it has affected gene. Okay, he's having some mutated gene. He is passing on the gene to his children. So if the expression or transmission of disease in the children, if it is occurring because of a single mutated gene, then that mode of transmission is known as the autosomal dominant mode of transmission. Okay, if the individual requires two genes, if the mode of transmission to the child, if it requires two genes for expressions of the disease, that is known as a recessive type of inheritance. Okay, we'll study in detail about the inheritances. Basically, the genetic variation, it may be because of either the specific traits. Specific traits are nothing but the traits which are seen only in a one particular individual, like the ABO, antigen blood oxygen, that system, the blood ABO blood level system, that is particularly a qualitative type of genetic trait which is seen in only one individual. And the normal characteristics by which an individual is identified, like the height, weight, size, these all denote the quantitative differences between one and all individuals. Those denote the characteristic traits which are particular to each individuals. Okay, we'll see the mode of inheritance. As I have already discussed, that if a single copy of mutated gene is responsible for causing disease in the individual, it is known as a autosomal dominant mode of inheritance. So autosomal dominant mode of inheritance is mostly seen in the heterozygous state individual. Okay, here both the males and females are affected equally, and the affected person, definitely he has a affected person, and only a single gene from an affected parent is responsible for causing the disease. So if for either male or female parent, if any of the one parent is having a affected gene, he just transmits the disease to his kid. And this trait, because being dominant in nature, it is seen in every generation. Okay, and if we see the pedigree chart of the autosomal dominant inheritance, the affected father, he transmits the disease to 50% of his children. Okay, 50% are unaffected and 50% are affected. So that's a dominant mode of inheritance. And autosomal recessive mode of inheritance, it is expressed only in a homozygous state individual. homozygous state individual means 2 copies of genes are present in that particular individual. So, and suppose only a single copy of gene is present, single copy of affected gene is present, that individual is called as a carrier. So the carrier individual, though he has an affected gene, he does not show the clinical symptoms of disease. Okay, that's why he is called as a carrier. In the homozygous state, both copies of genes are affected, both genes are present, both genes are affected, thus the individual shows the expression of the disease. Okay, the autosomal recessive mode of inheritance, basically 2 copies of genes are required for the disease to occur. That's the criteria here. So both the males and females are affected equally, and the trait appears in the siblings. So if we see the autosomal recessive mode of inheritance, if both the males and the female, if both are carriers, both are carrying a single copy of gene, so among their children, only 25% of children will be affected, and the 50% of children will be carrier, and 25% of children will be unaffected. So that's the mode of inheritance if both parents are carriers. Okay. It was proposed previously that the parents are related, that is in consanguineous marriages, the autosomal recessive mode of inheritance was seen more commonly. The chance of autosomal recessive inheritance increases many folds in case of consanguineous marriages. Now we'll see the X-linked dominant mode of inheritance. The X-linked, the name itself indicates that the gene responsible for causing the disease, it's present in the X chromosome. And we know normally the females are the one who have 2 X chromosomes. That is, they derive 1 X chromosome from mother, 1 X chromosome from father. So they are females are the one who have 2 X chromosomes. Whereas males, they have single X chromosome because they have a Y chromosome, right? They just inherit a single copy of the X chromosome. Okay, so the disease, X-linked dominant disease, it is seen more commonly in females because they have 2 copies of X chromosome. Okay, here the affected male, suppose the parent is affected, the male parent is affected, he transmits the disease to all of his daughters. And none of his sons are affected because sons, they have Y chromosome, right? So they do not inherit the disease here. Only the females are affected, and 100% of all the daughters of an affected male are affected. Okay, and if the affected female is a homozygote, that is, she is having 2 copies of the genes, then she transmits the disease to all her children. Okay, even the male children, even the female children. So first is the case where the male is affected, he transmits the disease to all his female children but none of his male children. Second is the case where the female is the affected parent is a female and she transmits the disease to all her children, both male and female children. Okay, so basically X-linked dominant disease, the effect is seen in females. Okay, suppose the affected female is a heterozygote, she transmits the disease to only half of her children. The X-linked recessive mode of inheritance, here the expression of genes is seen in case of males, but females, obviously females are carriers, they transmit the disease to their children, male children. Okay, because male to male transmission does not occur. Okay, that the X-linked dominant inheritance is seen in females, X-linked recessive inheritance is seen in males, and females are only the carriers for the disease here. Okay, the trait, it is just transmitted from an affected male through all his daughters, because daughters become carrier. From the daughters, it is just transmitted to her sons. Okay, there is no male to male transmission here, and females just become carrier and just they transmit the disease to their children, and the affected males, they are just related to each other through carrier females. So sometimes this was the mode of inheritance which is seen genetically, that is the autosomal dominant, recessive, the X-linked dominant and X-linked recessive. Sometimes what happens is the individual who has the gene responsible for causing the disease may not express the disease themselves. Okay, that is, they have the genotype responsible for causing the disease, but they do not have the phenotype, they do not show the phenotype. Such an individual, they become they are like hidebound for transmitting the disease to next generation. Okay, even though they do not themselves show the disease, they just transmit the disease to next generation. It's just an example of reduced or incomplete penetrance of the disease. It is an extreme variation. It is an extreme end of variable expressibility. The cause of reduced penetrance, this type of inheritance may be due to the influence of genes or the interactions of genes at the loci. Sometimes what happens is multifactorial inheritance of genes may be present, because a number of genes occur at different loci, and interaction of these genes at different alleles may lead to multifactorial inheritance. Okay, so that was all about the developmental disturbances of jaw, the developmental disturbances of craniofacial structures, and the inheritance of any disease occurring in the oral cavity. Okay, any familial disease occurring in the oral cavity. Suppose the heredity is the link, those are the common modes of inheritance. Now we'll see what are the agents which affect the children during embryonic development. The teratogens are agents that may cause birth defects when they are present in fetal environment. So the uterus or the fetus, it is extremely sensitive to any infection present in the mother, to any drug taken by the mother. So the fetus just tends to grab the drug or infection and shows the birth defects. So what drugs are responsible for causing this teratogenic agents? What drugs are responsible for causing the developmental malformations? It was earlier proposed that thalidomide is the one, the phenytoin, diphenylhydantoin. This has been associated with characteristic birth defects in the children. So any drugs, any chemicals, any infectious agent, any injury or any physical and metabolic agents which are taken by the mother, which the mother is exposed to, may lead to characteristic defect in the children or infant. And the expression of the disease or the expression of the developmental defect will be depending on the dosage, depending on the duration, the time the drug is, the individual is exposed to the drug, depending on the time, differences in the susceptibility, differences in the interaction between the drug and the environment. Okay, so basically this the clinical picture there, it's a congenital malformation of feet because of maternal intake of the thalidomide. The affected child, the child was affected and he showed characteristic deformities or malformations of the hand, legs and feet. So that was a brief introduction of developmental disturbances. Now we'll study all the developmental disturbances concerning the orofacial structures. That is the developmental disturbances of teeth, developmental disturbances of jaws, developmental disturbances of lips, developmental disturbances of palate, developmental disturbances of gingiva, developmental disturbances of oral mucosa, and so